want to discuss a small topic. Not small topic, but it's a big topic in fact. See, how the diabetes is on rise. How the diabetes is on rise in India. We are talking about our country. See, 30 years back, when I was an anesthetist for the last 35 years. So, 30 years back, when I was asking a patient, I am not talking about white collar job people like me. I am not talking about white collar job because they are liable for BP, hypertension, everything, BP, sugar, everything early, very early, because they don't work hard, they are doing least exercise, etc. I am only talking about people who are hard workers like agricultural labor, fishermen, etc., etc., daily labor. These are the people whom I am talking about. When I am giving anesthesia to those people about 30 years back, when I used to ask them, are you a diabetic, are you a hypertensive, do you have any heart problems, when I take an ECG and all, they used to say only 2 out of 10, they used to say, yes, I have diabetes. And about 3 people, they used to say, yes, slightly I have blood pressure, no thyroid at all. So that is the answer. After 10 years, 20 years back, slowly it doubled. 4 people used to say, yes, I have diabetes. And 2 people used to say, I have thyroid also. Like that, out of 10. And slowly, over a couple of years, 2 years, 1 to 2 years, I am seeing 6 out of 10, they have diabetes. 6 people out of 10, they have diabetes. And nearly 7 people, they have hypertension. Anybody crosses 30 years, they are hypertensives. And thyroid also. Among 10 people, you have minimum 3 people are having thyroid also, overweight, thyroid, etc., etc. So what I want to say is, what is the reason for this? Forget about environmental pollution. Forget about those things. What is the main factor? Because we cannot change them. Gadgets, electronic gadgets like cell phone, etc. We cannot change them. It is a must. In the modern world, it's a must. Environmental pollution also you cannot prevent. What can you prevent? Only diet and exercise. See, these hard workers, there is no need of any exercise for them. They are already doing a lot of exercise. Only thing is for white collar people like me and you, yes, you need exercise. 80% is diet, 20% is exercise. I already told this in my first 3 videos. Video 1, video 2, introductory videos. First 3 videos is full of this matter. How you can go back, how you can reduce your diabetes, how you can come back with diabetes. You can become completely, diabetes is reversible, hypertension is reversible, thyroid is reversible, everything is reversible, obesity is reversible. From 96 kg to 80 I came back, my thyroid became normal. I am not a diabetic anymore. I was taking insulin 3 years back, and my BP also, from 4 tablets I was taking 3 years back, now I am on a single tablet. I am on a single tablet right now. I am very, very comfortable. I have crossed 60 years, now I am 61, but the activity and all is just like a 35-year-old man. I don't say I'm proud of it, but it is because of this. What I have done is one thing, it is your diet you have to change. 80% diet and 20% exercise. Also, I told you in my second video, first initial videos, please try to see them. Now I am trying to stress on only one thing. First thing, to avoid BP, to avoid hypertension, to avoid sugar, to avoid hypothyroidism, etc., etc., obesity, you have to do only one thing. Just blindly, don't go for anything. Simple. Sugar, avoid sugar completely. Rice, avoid rice, whichever sort of rice, whether it is brown rice, whether it is black rice, whether it is whatever type of rice, avoid completely rice. Avoid wheat completely. Please go back to my initial videos and see what I have told you about wheat and rice. And jaggery, any type of jaggery, particularly jaggery from sugarcane. You must completely avoid. You can have little quantities of jaggery which is coming from toddy palm tree, and one more plant, Eetha chettu they say, okay, whatever it is toddy palm tree. Also people make jaggery, that you can take, because that jaggery, after going inside the stomach or intestine, to convert into glucose, it takes time. That's why you can use the toddy palm tree jaggery, little bit for your sweet uses. So please avoid these 4 or 5 things, and what you have to take. And regarding vegetarian diet, any curry you can take, but you try to avoid this potato, etc., those grown below the soil for some time to reduce the diabetes and all, and to wait for the weight also. Try to avoid the things which are grown below the soils, like tumors, like potato, sweet potato, things like that. Please try to avoid that. And and non-veg you can take plenty. You can comfortably take non-veg. Any type of non-veg is good. Oils, non-veg, etc. Previously there was a concept, try to avoid oils, but oils also, be careful. Always don't take these plastic bottle oils in shops. Try to go to that cold pressed oils that come in bottles. Try to avoid this plastic also, please. Actually plastic has nothing to do with diabetes, but cancers and all. So please try to take only cold pressed oils. Go to the nearest person with there will be a cow moving around. Okay, homemade oils. Please stress on homemade oils. Don't go for refined oils and all. They are very dangerous. Homemade oils. And most important diet in the place of rice and wheat, in the place of rice, millet. This year is called International Year of Millets, and Dr. Kadarwali was given Padma Shri also. I have totally come back only because of millets. Whether it is kodo millet, brown top millet, barnyard millet, little millet, foxtail millet. There are 5 types of millets. Okay, please use them 2 days. 2 days one, 2 days one, 2 days one. To get used to millets in the place of rice, it takes about 4 or 5 days. Very easy. Same curries, same non-veg, etc. But not with rice. You are taking with millets, and I am 100% sure that your diabetes will go, your hypertension will go, your thyroid will go. You will come back to normalcy, and you can avoid intensive care units. Please, that is my request. Please do it, and